Hello everyone, I'm Dr. Eric Ruhland from the St. Paul Pet Hospital. It's finally summer in St. Paul and we're enjoying some great weather, and our pets are getting outside, and we're seeing a lot more patients for this time of year for preventative care and getting things updated and making sure that our heartworm tests are done and that our heartworm prevention is on board and our flea and tick medications are getting done. And that's all really good. Thanks to all of our clients who've have been very patient through COVID and the way we've changed some of the operating procedures at the hospital. Both the Highland and the St. Paul or the Cathedral Hill locations are open, and they are seeing appointments for everything. One thing that I'd like to address with everybody, as we start to see, as a lot more of our clinicians start to see a lot more of our preventative care appointments, I see not a growing, but I see a thought process in our clients' heads that as pets get older, there is a diminishing return, or there's a diminishing value on getting your pets vaccinated as they get older. Or I hear it a lot, hey Dr. Eric, my dog's too old, he doesn't need vaccines anymore. That thought process really couldn't be farther than the truth. One, there's no such thing as being too old, period. And I'm speaking to everybody here, even the youngsters that are watching and my older clients. There's no such thing as too old to vaccinate. And in fact, when we listen to the CDC's recommendations, take for example the flu vaccine, who should be vaccinated first should be the old and the young, the very immunocompromised, and the patients that would not be able to fight off an infection that they would get. So, the vaccines that we commonly will administer yearly in our dogs in Minnesota here, leptospirosis, Lyme disease, Bordetella, those are incredibly important in our senior population as they're aging, because those dogs, if they get kennel cough or they get Lyme disease, they are going to be affected much more severely than, say, a young dog. But I think in our client and in a lot of our heads, we think, well, my dog's too old, he's just too old, he doesn't need his shots anymore. And that couldn't be farther from the truth. It really couldn't. Now, rabies is obviously a legal disease. All of our cats, all of our dogs should all be vaccinated for that. Regardless of age, they should all have up-to-date rabies vaccinations. Distemper and feline distemper and canine distemper, there's a little bit of wiggle room there as patients get older. If they've been vaccinated past 10, they're probably going to carry their titers out the rest of their life. And that's an every 3-year vaccine anyway, so that usually doesn't come up as too common of a question. But I really wanted to sort of hit the nail on the head and talk and address all of our clients that this mindset that as a patient ages, they don't need preventative care. I really want to flip that up on its head, because that's actually completely opposite. The older a patient gets, the more preventative care they need, the more touches, the more touches that we need to see them. We need to detect diseases earlier and make sure that their titers for some of these infectious diseases that they probably cannot fight off, that they have got good boosted titers, that they are ready for and they are protected. And that's at the end of the day, that is the cornerstone of preventative medicine, is us getting our hands on these patients and preventing them from diseases that will kill and can potentially debilitate them for the rest of their life. And that's the whole purpose of vaccines and vaccinations. So anyways, I'm Dr. Eric Ruhland from St. Paul Pet Hospital. I hope you guys are really enjoying this great weather that we are having, and getting outside and kicking out the dust from this long winter that we've had. And I hope to see you guys around the great city of St. Paul, and if not, at the Highland Clinic or the Cathedral Hill Clinic soon. Thank you very much.